Hi, my name is Teesha, and I'm the nurse at Marsden Women and Family Clinic. And today I'm going to teach you how to administer an intramuscular B12 injection for yourself. So first we are going to talk about the supplies that we need. You're going to need the needle that comes with your medication. You're going to need a cotton ball, an alcohol pad, and then the vial that says methylcobalamin right here like this. And the methylcobalamin is a form of B12 that's broken down into its most basic form, so your body doesn't have to do anything to use it. It can automatically uptake it and go forward with whatever it needs to do with the B12. And so the first thing that I need you to do is wash your hands. You want to scrub all surfaces for 20 seconds and then rinse really good, dry them off with a paper towel, and then you're good to go. Then you grab your vial and you make sure it says methylcobalamin, and you're going to hold it like this and then pop off the top while you're holding the base, just like that. And you're going to reveal the self-healing port right there. Now, what that means is that you can withdraw medication from it, sometimes multiple doses, and it closes back up so the medication can't leak out after you take your first dose out, or second dose or third dose. It keeps sealing itself up. So we have our supplies here. We've identified the right medication. We've popped it open. I'm going to go ahead and open our needle, and then we'll open our alcohol. So just like this, we'll throw that away. And then we're going to take an alcohol pad, and you want to scrub this self-healing port for 30 seconds, okay? And so just sit there for a second. You can sing to yourself if you need to. But what we want to make sure is that the alcohol dries, because the alcohol drying is what actually kills the bacteria. And so it's very important that we kill the bacteria on here, because anything that's on this can be introduced to inside of your body and can cause an infection. So that's why it's such a big deal that you scrub it really good, okay? And we're gonna let that dry. So after it dries, we're going to hold, you can break the seal on the plunger by pulling down. When these syringes come from the factory, they have a pretty nice seal. So just pull down, it breaks the seal and makes it a little bit easier to work with. Then you're going to take the lid off carefully, and this needle is sterile, so it can't introduce any bad bacteria to your body. You're going to hold your vial and insert the needle straight down into that self-healing port. Now we're going to slowly tip it upside down, and I'm going to hold it up like this. You want to kind of look inside of the vial through underneath the label, and some light will come through. You'll be able to see the needle. So you want the needle to barely be inserted into the vial, and then you can pull the plunger down, and you want to go kind of slow. It takes a minute. So depending on your dose, you may be prescribed 1 milliliter or 1,000 micrograms of methylcobalamin. Some people are prescribed 1,500 milligrams. And so just make sure that you are pulling up as much as you have been prescribed. So this syringe just so happens to be a 1 milliliter syringe. And so I got a little bit of air in the syringe, and that can happen sometimes. That's okay. I'm going to flick it, make way for the air bubble, and then try and push it back in to the vial. Now I'm going to bring the needle back down again to where it's barely inserted and withdraw the rest of my medication. So the very top of the black plunger is where the mark that marks our dose. So I'm going to bring it in real close here, right there it says 100, okay? And for this syringe, that's a 1 milliliter dose. Okay, now that was the fun part. So when you give it to yourself, the best place to give it is right in the back of your hip. So you can take your pants down a little bit and then roll up your shirt. You have to get some twisting in, okay? So then you hold your needle out so you don't poke yourself. And same thing here. We're going to scrub with alcohol in a circle. And we want to make sure that all the bacteria on our skin is killed as well so that we don't drive it to the inside of our body. It can't hurt us so much on the outside of our body, but it can hurt us on the inside. So we'll just let that dry. Don't fan it because that can introduce bacteria as well. So we just let it air dry. Okay, and then pull up on your skin. And then you're just going to come in straight at a 90-degree angle. Okay, you give a little bit of momentum and it will go right through. 1, 2, 3. Okay, now depress the plunger and let go and withdraw the needle at the same time, like that. Okay, and then you can check. Sometimes you'll cause a little bit of bleeding. That's okay. Sometimes a little bit of the medicine will come out. That's okay too. And I had a little bit of both that time. You just dab and then you're fine. So now that we've administered the methylcobalamin, we want to make sure that we don't stab ourselves with the needle. You'd be surprised they can go right through that cap. So what you do is you put your cap flat on the surface in front of you and then you scoop it like this, okay? Grab it at the base and then pull till it snaps. Now you can't hurt yourself with this and you can dispose of this sharps. It's used, it's not good anymore. Dispose of it in a sharps container. And of course, if you have any questions, you can give us a call at Marsden Women and Family Clinic. Thank you.